today, so be aware of this. Please switch off your mobile phones. Those who are online, please make sure you're muted until your turn is on. Interventions from online should be via the Q&A system rather than the chat. There will be several speakers, and I think that's the next slide. The first speaker will be Peter Hoet, Professor Peter Hoet from here, KU Leuven. He's the PI of EXIMIOUS, and he's also the coordinator for this event here, together with Sylvain Sebert. Peter Hoet is head of the Breathe laboratory in a building close to here, heading the lung toxicology unit, and as I said, PI of one of the projects, namely the EXIMIOUS project. I will introduce the further speakers as they come. We will have people from the European Commission and also from WHO. And without further ado, I will invite Peter to give an introductory talk, Understanding the Human Exposome.
Thank you, Ben. Welcome everyone on this day. So I'm here to explain or understanding the human exposome, something that has been touched on a few times this week. So I thought maybe it's good to try to explain that via our invitation cartoon. So exposome research, and that is what I would try to explain, and also the different cartoons on it. The policy part on the title of the day, I leave to other people. So what is the exposome? So general definition is that the human exposome is all the exposures that we encounter throughout all our life, really starting from conception to the end of our life, which has and will have an impact on our health and well-being. And you see the life course is there shown in the picture. And also from the invitation, it's an attempt to show the different types of exposures. So diet, infections, so that's also an exposure. It's not only the chemical exposures that we encounter as chemicals from pollutions, but also, and it's good to mention that once more, also socioeconomic factors, living close or further away from green or blue areas, and also our lifestyle and occupation. But I come to that in more detail in the next slide. So in exposure, we look into at least two different exposure types, from external and from internal. And this external exposure is divided in what we call the general environment, or and external exposures, things that all people are exposed to when they live nearby each other. So chemicals in the neighborhood, metals, air pollution, noise, green-blue areas, how the built environment is, but also your own specific exposure, self-inflicting sometimes, depending on your gender, your age, your social context you live in, but also the medication you take, the work you do, the diet you follow, your lifestyle, and so on. And then internal exposures, somehow clearly linked to external exposures, as we measure in biomarkers of exposures that can be linked to our metal and chemical exposures, for instance, from outside, our health status, and our genome. So our genetic background, very important, genome and epigenome, but also other issues or elements are measured as telomere lengths, transcripts, and if we measure all the transcripts that we can find in someone's blood sample or another sample, then we call it transcriptomics, and also proteomics, proteins, and all metabolic factors. So that is one thing, but there is another layer of complexity, because I think it's already clear that exposome research is quite complex, because we try to look at these different elements, but how to assess this, so how to collect the data really needs different specialists. So for chemical analysis, and I will not go in all details here, that there are so many techniques to analyze chemically very precise what we are exposed to. We have models for air pollution, but we also measure it for sure, and for location, because where people live close by or further away from green or blue areas, then we need the coordinates where people live compared to the coordinates where these spaces are. And the same or other techniques, as for instance questionnaires, are used to get a view on people's diets, jobs and job exposures in GEMS we can look at, and so on. So just to show you the complexity. And at the other side, the internal exposure, very specific techniques that has been developed more lately as SNPs that are looked at, all variations in human genome, DNA methylations for epigenome, and so on. So, but I will not tell them all in detail, but I wanted to show you the complexity and how many different specialities we need to do good exposome research. And this is in fact showing the same as I already showed. So the exposures, our life course, and all the internal measurements we can do, and that results in many different data sets. And these data sets have to be interpreted and integrated in statistical analysis, but we also use, and we have the help of computer specialists that can help us with AI to really getting a more deeper insight into all this complex data, and that at the end results in different tools from biomarkers, exposure tools, but also disease markers, predictions of disease, and get an insight in mechanisms. And then the next, so that is, I try to explain you what exposome research is about and how complex it is. And then what is EHEN? EHEN is a group of 9 European, or a cluster of 9 European large-scale exposome projects. And we have one common goal, that is understanding the health impact of a lifetime exposure on our health, sorry. And you can see we all together we are big. The project in itself are big. We come all together from 24 different countries, 126 research groups, and it has quite some funding, this cluster of exposome projects. And you can find us all at www.humanexposome.eu. And these are the different projects in brief summarized, and I have to tell you, I cannot explain you exactly what they're all about specifically. Some of them are more focused on occupational environment, some are more on urban environment, and so on, mental health, all very different. But there are posters of all projects outside. You also can find information for sure on our website. And so just to give you an impression of what are the different types of diseases being studied linked to exposome. So it's a very big cocktail of different diseases, systemic sclerosis, allergy, all linked to allergy and immune-mediated diseases. Then Another big block is cardiometabolic and vascular diseases, mental and neurodevelopmental disorders, and some on respiratory diseases. But this is not an exhaustive list, so just to give you a glance of what we are doing. And so, is this needed? Just with these cartoons, I try to explain that, yes, because there are quite some issues with diseases in Europe. For instance, 1 on 3 school children or school-age children are obesity or pre-obesity in Europe. 9.5% and 8.2% of adults suffer from asthma. We see that a lot of premature deaths are counted, unfortunately, still in Europe from air pollution, and partly cardiovascular disease is linked to that, and we see that also is a very important at 45% of Europeans. And then green spaces, so more the broader context. So a lot of us live quite far away from it, more than 300 meters. And that has an impact on, for instance, mental health and something else, metabolic diseases as diabetes is really having a big impact on our health status in Europe. So what are the expected outputs? And that will come later on at the end of this day also. But we are trying all together with the 9 projects to build a toolbox of different tools. So we have, at one hand, many different big databases of fair data which can be multi-used and reused as much as possible. We have a lot of new techniques being developed in analytics of these big databases with machine learning, artificial intelligence. We have exposure models being developed, European maps on sound, on light, on air pollution, so that there is a good view on where the hotspots are. We have development of a reference exposome in Europe and try to get to cost-effective models in prevention and so on. But next to that, we certainly have also a lot of scientific publications, many still to come by the end of the projects in 2 years or 1.5 years, and try to fill some knowledge gaps. We have policy briefs, we try to disseminate our information in a way that it is understandable for a broader public. And I think what is also very good, that we built a European global exposome community, and hope that EHEN gets a follow-up, that for a long time we can keep on doing this good research all together. So thank you.
Thank you very much, Professor Hood, Peter, for summarizing a huge amount of information. And I'm now pleased to introduce our next speaker. She will speak from Brussels, I guess, online. Dr. Rita Araujo is a policy officer in DG Research and Innovation, in the unit of health innovations and ecosystems. She has a background in biology, obtained a PhD doing fundamental research until 2016 in the area of environmental sciences. She worked at the GRC of the European Commission until 2021 in the Sustainable Resources Directorate, and she moved in August 2021 to her current position, where she leads the Environment and Health team and the Destination 2 of Horizon Europe Cluster Health. And she is the right person to take the floor now. And I hope she's online and ready to address you. Thank you very much.
Yes, good morning. Can you hear me?
Yep.
Yes?
Yes, I think yes, you can hear you very well. Thank you very much.
Okay, thank you very much. Good morning, and thank you for the invitation to speak at this event and present the expectations from the perspective of the EU research policy regarding the exposome research. I apologize for not being in person in the meeting, but the Horizon Europe Info Days for the topic of 2024 happen also today, and I will have to participate in the session of Destination 2 that will start in 2 hours. Peter presented very nicely what the concept of the exposome is about. I will build on his explanation during my presentation. So keeping in mind the cross-life stages perspective, the variety of living and working environments, and the combination of different sources of exposure that contribute to a global exposome concept. Can you see the second slide?
Yeah, perfect.
Okay, so it's moving well. All these aspects that I mentioned just now link very closely to the different aspects of the research we fund on environment and health, which provides insights on different angles of the exposome research, as I will mention later in my presentation. So you see in the center of this picture, the research of environment and health and the main policy overarching areas to which it relates. The evidence generated by research in this area can provide important information to the implementation of different policies and policy initiatives, like, for example, the European Green Deal and the initiatives that are related, like the Chemical Strategy for Sustainability or the Zero Pollution Action Plan, as my colleague from DG Environment will explain later today. Also, occupational health and safety policies, such as the EU Strategic Framework on Health and Safety at Work, urban health policies, considering aspects that were mentioned also yesterday in the presentations, such as, for example, air and noise pollution, and public health policies. And I can give, for example, I can give the example of the Youth Beating Cancer Plan. Maybe the most comprehensive EC policy initiative related to environment and health is the European Green Deal and related actions in the area of climate change, pollution, biodiversity, and food systems. One of the objectives of the Green Deal is to protect the health and well-being of citizens from environment-related risks and impacts. And as you can see in this slide, the role of research and innovation in providing evidence and tools that will support this objective is clearly recognized in this initiative. This figure shows the importance of this policy initiative for the environment and health area of research. The figure in the left side shows an analysis we did where we connected the clusters of H2020 and Horizon Europe projects on environment and health to specific policy initiatives and their main policy areas. And this is the result obtained, which shows clearly that the strongest link can be established with the policy initiatives under the big umbrella of the Green Deal. I would just like to mention, but I will do it very briefly because WHO is also participating in this session and will for sure develop this link further. But still, I would like to mention that a very important initiative at the international level that provides also policy context for this area of research is the work of WHO, of the WHO Task Force on Environment and Health and the European Environment and Health Process. I will now move to a bit to the description of the research we fund under Horizon Europe in the area of environment and health. And I will start by showing this figure that describes the structure and different instruments of this EU framework program of research and innovation. This is a complex picture that I will not describe in detail, but I would like to focus specifically on Pillar 2 and cluster health, which has 6 areas, and each area is called destination, and there is a specific destination that is destination 2, called living and working in a health promoting environment, and that's where a very significant part of the environment and health research is funded. This slide shows the trend in EU funding on environment and health research across different research framework programs, starting in 2000 and going until the second year of Horizon Europe, so including the topics funded in 2022. There has been a considerable increase in the EU funding allocated to this area of research over the years. In total, across the different framework programs, 700 projects were funded with an EU contribution of 1.4 billion euros. I include also in the slide the links to a number of resources where you can find more details about this area of research. If we analyze this overall picture by main research areas and considering number of projects funded and also the budget involved in each one of these goals, we can see that a wide variety of exposures to environmental stressors are covered by the environment and health research activities, and that most of these areas are of high relevance to the exposome research. And in fact, research on global exposures to environmental determinants, here identified under the category of risk factors in dark purple, received an important contribution in the last framework program. So these numbers refer to H2020, the H2020 framework program. We started this approach under Horizon 2020 and strengthened it in Horizon Europe. And in the environment and health portfolio, the projects funded under the same topic goal are encouraged to collaborate in the so-called clusters of projects through joint activities, such as it's the same that happens with EHEN. And that's what this figure illustrates. I use as an example one of the environment and health clusters, the cluster on micro and nanoplastics. And this shows the connection between the different projects that contribute to different working groups. And the objective of this approach that we are implementing is to promote synergies and knowledge sharing, and increase the societal and policy impact of the research actions that are funded under these framework programs. In this next slide, you see that there are currently ongoing under the environment and health portfolio several clusters of projects, including projects from H2020 and Horizon Europe, in different areas of research and covering different aspects of the impacts of environmental stressors on health. These include, for example, exposures to chemicals such as endocrine disruptors, the impacts of indoor air pollution, micro and nanoplastics, electromagnetic fields, and others. And these projects use a wide variety of approaches, like by monitoring, omics, cohorts, etc., and study a wide diversity of health outcomes. And I can mention, for example, respiratory, cardiovascular, and immunological diseases, among many others. This represents an incredibly valuable source of data and evidence that can be used and integrated in this global approach that the exposome research brings. And indeed, as you can see in the second line of this table, the largest cluster concerning number of projects, EU investment, and number of research groups is the European Human Exposome Network, that demonstrated in this annual meeting during the last 2 days this great value and the amount of evidence that it can generate. Before diving specifically on the exposome research, I will very briefly mention two big research initiatives at European level that will provide also a lot of important data that can be used also to feed global research looking at global exposures. And these are the European Human Biomonitoring Initiative that ended last year, and the European Partnership for the Assessment of Risk from Chemicals that started also last year. Traditionally, the EU research support for environment and health was dominated by actions that were focused on the classical one exposure, one health outcome approach. And in more recent work programs, the added value of addressing multiple exposures over various life phases and considering multiple living and working environments has become evident. Thus, two calls for proposals were launched in FP7 addressing this exposome concept. On the left side of this slide, you see the three projects that were funded at the time, which formed the EU Exposome Initiative. ELIX, that was focused on the early life exposome, exposomics, which studied priority exposures and health outcomes, and HILS, working on longitudinal environmental and health assessments linked to the development of non-communicable diseases. Following these research actions in the next work program, which was Horizon 2020, a call was launched entitled the Human Exposome Project, a toolbox for assessing and addressing the impact of environment on health. From this call, 9 projects were selected that work collaboratively under the European Human Exposome Network. This is currently the world's largest network of projects studying the impacts of environmental exposures on human health with an exposome angle. And you can see here, as Peter also presented, the 9 projects of the network mentioned. More recently, in 2022, another important step for the research in the area of exposome was taken with the launch of the preparatory phase of the environmental exposure assessment research infrastructure, EHEN. This infrastructure aims at centralizing data and capacities with an important focus on the chemical exposome. And even more recently, in the Horizon Europe call of Destination 2 of Cluster Health for 2023, a call for proposals for a coordination and support action for global cooperation in the area of the exposome was launched. The call closed in April, and the outcomes of the evaluations will be known in the coming months. One of the important objectives of this call is to propose a global governance structure for a global human exposome network, and it should build on the initiatives that happened in this area in the past years, including obviously the European Human Exposome Network. And I will end here. Thank you very much for your attention.
Thank you very much, Dr. Araujo. Are we having the discussion now or moving directly to?
We have Q&A later, so we first have the presenters.
Okay. Thank you very much. So we will switch to the next online presentation by Dr. Sinaya Netanyahu from WHO. She is in the Environment and Health Impact Assessment. She's the program manager of that section in Bonn, in the European Center for Environment and Health of WHO. She previously served as the chief scientist of the Ministry of Environmental Protection in Israel. Dr. Netanyahu, the floor is yours.
Thank you, everybody.
Thank you very much.
Good morning. Thank you very much, Chair, and thanks a lot for having me here. And I'm sorry for not being able to join you personally. Hopefully next year or next meeting. So my name is Sinaya Netanyahu, and I am a program manager, as you said, at the WHO European Center for Environment and Health. And this is a very unique center, as I will soon explain. The center was actually established more than 30 years ago in the first ministerial conference on environment and health. Rita already mentioned the upcoming 7th ministerial. I will discuss it later, but it was established back then. And we basically, the main purpose of the center is to be a technical and scientific center where we provide expertise on the impacts of environment and health. We provide our 53 member states, so it's beyond the European Union. It's 53 member states across the WHO European region, including Central Asia. And we provide them with state-of-the-art evidence on existing and emerging environmental and health risks. We develop policy, advise, and international and regional guidelines, which I will mention a few methods, also tools, and mainly to inform and support decision-making, but not just in the health sector, but also in the environmental sector. We assist member states in both ministries to identify and implement policies to protect and promote health, and to support member states also in the implementation of commitments on environment and health. So really, this is a very rare and unique opportunity, even within WHO, to work formally with two ministries, two sectors that affect so much of our health and well-being. As you probably know, the 6 core functions of WHO are as follows. Global leadership and advocacy, knowledge management for policy making, normative guidance, research and knowledge, policy and technical assistance, and monitoring and evaluation. And I will try to give examples to those things as we go along. But where is our mandate is coming? The mandate is basically, first of all, right now, it's really the governing agenda, the 2030 Sustainable Development. And if we look at the 17 goals of the Sustainable Development Goals, all of them, in one way or another, relate also to health and well-being. Obviously, there is goal number 3 that is concentrates on health and well-being. But the more important things to see is there are many actions that you can take, let's say in WASH, in climate, etc., that and you can extract with one action lots of co-benefits that may affect many of the goals. So this is something that we also keep in mind. We also work, it allows to work across sectors on different factors that affect health, including social, economic, and obviously commercial and environmental determinants. The other frameworks, the WHO framework, comes one from the global framework, the 13 Global Program of Work, where our Director General has established 3 pillars to improve the health of 1 billion people, that they will enjoy better health and well-being, 1 billion people that will have a better protection from health emergencies, and 1 billion people that will benefit from universal health and coverage. Along these lines, we also have a European program of work, which I will not much elaborate, but it's again, it's actually echoing in a way the global framework. So within these 2 frameworks, we do develop our own work. But as you know, I mean, we cover in WHO many more fields except in environment and health. But when it comes to environment and health, WHO developed a strategy, including obviously climate change, where it lies on, it identify all those sectors of water, sanitation and hygiene, energy, industry, services, housing, labor, land use, planning, transport, and agriculture, with 6 strategic objectives. First and most importantly is really primary prevention. How can we prevent those health, environmental hazards and risks? The second strategy objective is to work and to act across sectors, in a cross-sectoral way. The third thing is to strengthen the health sectors, then build support, enhance evidence and communication, and also build on our monitoring capacities, and etc. So going back now to the history of this center, the European Environment Health, and it's important because I think that once you look at the history of this negotiation with the 53 member states, you can see it's actually a very interesting case study, a story by itself. You can see the development in focus of policies and focus and agendas and requests by member states. At times, the focus was on children. At times, the focus was on partnerships, etc., etc. And the recent meeting in Ostrava in 2017, interestingly enough, the member states have decided to focus on 7 priority areas. One of them is indoor and outdoor air quality. The second one is wash related. The third one was chemicals. Fourth one is climate change, obviously adaptation and mitigation. The fourth one is waste management in contaminated sites. And to bring it into the more circular economy context. The next one is cities and region, how we can help them and support them to become healthier. And the last one is to build environmental sustainability, sustainability of health systems. So one thing that can jump immediately is that there is a very silo kind of approach, and this is, I will come back to that. But I mean, there is obviously for an institution like WHO, I mean, we do have to be very careful and very good in each specific sector as it covers so much. I'm sorry, but I have echo. I think, Elizabeth, you may want to. Thank you. Thanks. During COVID, there was an in-house check to see what can be done in order to recover quickly from the impact of COVID, and how can we do this recovery to make sure that it will be a green recovery? Because, as you know, lots of money has been invested, not necessarily in a green way in the recent few years, and there is some evidence, I think, in the OECD report and UNEP reports on that. But what was said in 2020, in the midst of COVID, by WHO headquarters, they designed those elements of how we can, the 6 prescription of how we can build forward better. So one of them was to protect and preserve the source of human health, and which is nature. And I will come back to that soon. And then they invest in the essential services in healthcare facilities, including wash, sanitation, waste, etc. The third one is a quick and healthy energy transition because of the double swords. I mean, energy transition was the faster we do it, the less air pollution issues we have and better climate progress we can make. The fourth one is to promote healthy, sustainable food system. Fifth one is to build healthy, livable cities. And the sixth one touches an economic policy where we are saying to stop using taxpayer money to fund pollution. So it's even before the polluter pays. I mean, let's stop subsidizing polluting activities. And I will skip maybe this thing, and I will go straight to our work. We in the center, how we work in the center. So first of all, we have several units. One is that is specializing in living and working environment. And they actually the global air quality guidelines that I'm sure that you are all aware of, and I will discuss this in a second, was developed here. But in addition to that, we developed tools to assess health impacts of air pollution. This unit also covers chemical safety and human biomonitoring, covers mental health and urban and green and blue spaces, and also deals with environmental noise, and you may be more familiar with the recent, for a few years back actually, the environmental noise guidelines that was especially produced not for the global purpose, but for the European regions. So this is to describe examples of normative works, the air quality guidelines and the noise guidelines. If I just say a few words on the global air quality guidelines. So again, why we need something new? Because the previous one was done many years before that, but it marked an increase in quality and quantity of evidence. And this is also due to the research community that came up with, quite a bit of significance and substantial research to support that there is actually new evidence and there is a need to revise and change the guidelines. There is a better insight into sources of emissions and global concentration of pollutants. There is better insight into the contribution of air pollution to global burden of disease. Obviously, by developing something, a new guideline like this, we can address better the issue of inequities in relation to air qualities, and also it's a significant advance in worldwide adoption of the 2005 air quality guidelines. Unfortunately, we do see many countries, even in the European region, that are still lagging behind and not even meeting the 2005 guidelines. And as I mentioned before, mitigating air pollution obviously has a more central, becoming a central topic within WHO, but also in the entire activities of the United Nations, etc. So there are, I will skip that for sake of time because I want to cover a few more things. But there were also, we explained what is new, and I refer you to the guidelines to look into that even more. And the evidence, the guidelines, as an evidence-informed tool also helps not just to reduce, level of air pollutants, but also hopefully decrease the disease burden due to air pollutants, air pollution exposure worldwide. The second thing that I was mentioning is the climate action. Reducing air pollution, we also help to mitigate climate change. And finally, this whole exercise of developing the guidelines and doing the evidence review before that helped identifying critical data gaps for future research to better protect people from harmful effects of air pollution. Some of the priority of research, and this is perhaps one area that I will go in depth, is to set priorities for policy relevant questions. And again, I remind us the diversity across the European region, continue to develop impact assessments method, improve methodological approaches, and also do research into mechanisms of health effect and research a broader range of health endpoints and improve assessments of intervention of effectiveness. I will also mention one more thing is about chemicals, because it was also discussed before, and it's really important just to show the gap. I mean, there are 100,000, I mean, this is an EEA infographic, 100,000 chemicals on the market. However, only 5 of them are extensively characterized for their hazards and exposures, and 70,000 are poorly characterized. So we have a huge way to go in order to cover and the understanding of and the characteristic of those chemicals and the impact on human health. So this is yet to be done, and the question is again how we do it effectively and wisely, giving so many limited resources that we have all over. Commitments on objectives and priority exchange that our office has identified are as follows: chemical exposures and risk assessments. This is one priority. Looking into chemical mixtures, which is a huge challenge. Increasing understanding that we need to look into indoor air pollution, and there is an increasing interest in that. Facilitating implementation of global policies. Also looking into chemical emergency and the IHR. And national policies in action, vulnerable population, and also obviously to promote safer alternatives. In that regard, I would like to mention one outcome fresh from the oven from this week that came from the World Health Assembly in Geneva, is a new resolution adopted globally by member states on chemicals, waste and pollution, and encouraging WHO, asking actually WHO to further develop the understanding on the health impact of chemical waste and pollution. So I also invite you to look in this new resolution. It's the first time that such a resolution is being drafted and adapted, which is a great news for the community that deals with those topics. Quickly moving, and I do it very briefly because of sake of time. climate change, all those classical issues that you know about promoting health and climate adaptation and mitigation policies, providing member state tools to assess health and co-benefits of greenhouse, etc., addressing extreme weather events and health impacts. All those things we are doing routinely. All those things are characterized by research gap, as you know, and all those things are in huge demand. Water and sanitation, it's still on the table. It's not old news. We're still working with member states. Many member states still suffer from having limited availability or access to safe and equitable services, wash services. We still need to have risk-based management and surveillance approaches. So there are lots of issues in this area that are to be further looked at, monitor, this researched, etc. Something that is really important to mention in regarding to COVID also is the water-related disease surveillance, but it's not just COVID, obviously. All water-related disease surveillance and wastewater-based epidemiology is an increasing topic in the last several years, and also DG HERA is interested in that, and many other countries across the European regions are very much looking into these tools. We also deal in the center on issues related, this is in my program, on issues related to the urban environment. We looked at resiliencies, we looked at many environmental and health issues within the urban lives. We looked into circular economy and waste and redevelopment, waste management and health, and also redevelopment of contaminated sites. We obviously looked into health impact assessment, and recently, just this week, we published a very interesting survey work on a survey that was looking into implementation of health impact assessment, or looking into health, that health dimension within environmental impact assessment in our 53 member states, and to see how, what are the gaps, who is practicing, who is implementing that, etc., in order to understand how we can further support member states in using this tool. We also look into inequalities in environment and health. Our major challenge in looking into inequalities in the region is that most of the data is available from Eurostat, from the European Commission, European Union member states, but when it goes to Central Asia, when we go to eastern part of the region, we are having a problem with limited information. And when you have limited information, it's very difficult to assess and address policies with respect to inequalities in environment and health. Intuitively, obviously, those inequalities are there. We do know that, but we need more than just intuition. We need evidence, and those are not necessarily always being measured. And it's a major, major challenge. In recent year, we moved into nature biodiversity, looking into and unfolding the interconnections, and much more recently, as you know, WHO and also several other UN and agencies are looking now as a quadripartite, UNEP, WHO, FAO, and the World Organization for Animals Health. We are looking together at the role of the environment in One Health. This is, we are very highly invested in that, in globally and also regionally. Our center also developed a very nice product on looking into the role of the environment in One Health from a health perspective. Obviously, this whole interaction of animals, human, and environmental health is very much on the table. So it's not just the non-communicable diseases, but related to environmental health, but we also must address also those infectious issues and communicable diseases as well. So this is something that we are very much interested in, and there is a huge gap in understanding not just the impact of zoonotics and antimicrobial resistance and food safety, etc., but also the issues that related to pollution and how that affects, health of animals, human being, and environment. And this actually, the issue of chemical waste and pollution was also, in the context of the One Health approach, was also included in this resolution that I just mentioned a few minutes ago, calling WHO to also look into utilizing this approach of One Health, also investigating the relationship of chemicals and waste and pollution into this three interconnected health issues, health domains of human, animals, and environment. We also have a program that encourages partnership, because what you are demonstrating today is a lot about partnership. I mean, Exposome could not be there without partnerships. So we also encourage partnerships, and we will be renewing some of the partnerships that have been decided and took upon a few years ago in Ostrava in the previous ministerial conference, but there will be more partnership. Right now, we have a partnership on climate change. It's called EHEC. We have a partnership on transport, health, and environment, together with the UNECE. We also are going to have a new partnership announced on biomonitoring in this coming up ministerial conference. So just a couple of words, and I will conclude with that. A couple of words on the ministerial conference coming up in the 5th and to the 7th of July, where we are going to get together 53 member states, both sectors. Ministers will agree on innovative policies to ensure long-term health effect and well-being, and hopefully this agenda will carry us in the region in the next 6 years or so. The collaboration of this process is done together with UNECE and UNEP, obviously, and a big involvement also with the European Commission, who is not officially in the Secretariat, but very active in supporting the process, as Rita already mentioned. This year, the conference is going to be hosted by the government of Hungary and under the patronage of the President of Hungary. And this is the last thing that I want to say. If you recall, I showed you the 7 silo priorities that were decided in the previous ministerial conference in Ostrava in 2017. This time, member states are asking us to look into the triple crisis: the environmental pollution, climate change, biodiversity loss, and land degradation, and to look at them and to see how they affect health. So it's not just looking at each of them individually, but also looking into the interactions and the interconnections between them, and how they both, because they both, I mean, all the three sources of crisis, so domains of crisis, obviously affecting each other, and also creating a much faster even changes and effects. Climate change and biodiversity, obviously, vector-borne diseases. So we see stuff that we haven't seen maybe before. We have an increase in temperature, etc. So all of those are happening much faster and much more complex. So this calls so really into a more a much deeper understanding of how to deal with the environment and health. Than maybe ever even much more than even before. In addition, we will be looking also the conference on building how to build forward better from COVID, including action for urban resilience, and also we will emphasize the issue of protection of vulnerable population and vulnerable in the vulnerable life stages. So I think with that, I will conclude, and thanks a lot for the time.
Thank you very much, Dr. Netanyahu, for giving us the voice of WHO, and clearly it resonates very well with the priorities of WHO, with the priorities of the EU. The next presentation will be given in person by Mrs. Lorena Korosec. She's a policy officer in DG Environment's unit, Green Knowledge and Research Hub. Her role, as she will probably explain, is to reinforce the links between EU research funding programs and EU policy implementation and development, with a view to better serve the objectives of Commission policies, in particular the Zero Pollution Action Plan.
Hello, everyone. So thank you very much for inviting me for this nice introduction. So my name is Lorena Koroshets. I work in DG Environment, as already said, in the research team. But I'm also here representing the policy directorate, zero pollution, because in my work I focus mostly on the research related to zero pollution, so the covering research related to zero pollution policies. So my policy colleagues would tell me that they are very, very interested in your research work, and they are very eager to hear the results when they're available. So it was the last slide of the previous presentation of the Dr. Netanyahu, and it's my first slide in my presentation. So not to lose more words, but it's really important to look through systemic lens about this triple planetary crisis of climate change, biodiversity loss, pollution, which is then also exacerbated with the use of resources. As a starting point, of course, we know that there are links between the environmental pollution and health. You can see some statistics on the slide from the European Environment Agency. Cancer is #1 among the non-communicable diseases, and the agency estimates that around 10% of all cancer cases in Europe are due to the environmental pollution. Unfortunately, pollution also affects the most vulnerable groups, so children, elderly, people with medical conditions, and also people living in poorer socioeconomic conditions. So this adds another deeper socioeconomic dimension to this complex picture. So today I will focus on the Zero Pollution Action Plan. It's a strategy or initiative under the European Green Deal. Other important elements under the Green Deal that we also very much work together with in our DG Environment is also the biodiversity strategy and the circular economy action plan. But of course, for the zero pollution ambition of the European Green Deal, a very important strategy is also the chemical strategy for sustainability. So the Zero Pollution Action Plan was adopted in 2021, and it set out the vision for, so the Europe by 2050 should reduce the pollution to the levels that would be no longer considered harmful to health and natural ecosystems, so creating a toxic-free environment. And this vision was then translated into the targets for 2030. So we have here, I hope you can see targets. In general, there are 6 targets, but you can see divided into 3 parts. So these colors show 3 key thematic areas of the Zero Pollution Action Plan. So the blue, the blue targets in blue circles relate to health. The green relates to biodiversity and ecosystems, and the orange relate to production and consumption. And I will say a little bit more about the health-related targets later, because as you may know, in December, we published the Zero Pollution Monitoring and Outlook report, which also assesses the progress of these targets. Just to mention, so the Zero Pollution Action Plan, you know, there are 3 areas. We have those 2030 targets, and then because it's an action plan, we have actually 33 actions developed that we are now implementing, and also 9 flagships or so-called integrative initiatives. I will only focus here on the flagship one, which is reducing health inequalities through zero pollution. Here I also added the link to our website where you can follow the progress of all the 33 actions and 9 flagships. So there has been a lot going on this health-related flagship. It's really an important central point of the action plan. I will not go through all the list on this slide, which relates to the activities of this year. So in 2023, we see there are quite some ongoing work on the legislative side. For instance, in April, there was this new pharmaceutical package that was adopted by the Commission, and it's also very relevant for our discussion here. But I would just maybe mention the non-legislative initiatives and activities. For instance, the EU Cancer Inequalities Registry is a tool, an online tool, and DG Environment works closely with DG Santé to also provide the air pollution data and incorporate into this tool as environmental determinants of cancer. And until 2024, more pollution data will be integrated as available and possible. Then in May, the European Environment Agency launched the Environment and Health Atlas. It's a communication tool targeting the general public, and it really provides interesting integrated picture on how environmental pressures affect health and what are also the benefits of nature, and so for health and also mental well-being. So I thought this tool is really nice. It has a lot of nice integrative and interactive maps, and there might be an opportunity also for your projects, for your work, to be also reflected in this atlas in the future, because still a lot of new data can be integrated, and it can be always improved. And then just to mention that in 2 weeks, we are also organizing a workshop on pollution and health, so in the European Commission, but together with the European Environment Agency. And the main aim of this workshop is to connect the environment and health sectors better, to really reinforce this discussion. Okay, there have been a lot of legislative work done also last year. So just to mention, in April, the Commission adopted a proposal for the revised Industrial Emissions Directive. And then in October, another zero pollution package was published, and it contained 3 legislative proposals to revise air legislation on air quality, water pollutant, and wastewater treatment. Here on the slide, you see selection of some of the elements from these proposals, which are now being negotiated with the Council and the Parliament. But of course, this is by no means a comprehensive summary of the proposals. I can perhaps mention that very quickly that this proposal try now to address better the problems related to emerging pollutants, so micropollutants, chemical substances such as PFAS, but then microplastics and pharmaceuticals, to really strengthen this approach or principle of polluter pays, so polluter pays principle, And then when it comes to air quality legislation, it does try to align closer the emission standards to the WHO guidelines that were presented earlier. So one of the recent initiatives or outcomes was also this first ever integrated zero pollution monitoring and outlook report. It was published in December, and it consisted of two parts. So the monitoring assessment prepared by the European Environment Agency and the outlook report, which was led by the GRC. So of course, the monitoring assessment is really about assessing progress based on the past monitoring trends, and the outlook is based on the projecting those pollution trends into the future with modeling tools. Overall, there have been some progress done, and the implementation took off, but of course there's still quite some shortcomings, and quite some of those targets that I showed you earlier in the presentation risk not to be met or achieved. If I focus a bit on the health-related targets, we can see that regarding the air pollution, so air pollution reduction target, we see that we are more or less on track. So if the implementation is complete, if we manage to have a full implementation of the existing legislation, then we might achieve this target of reducing by 55% the number of deaths linked to air pollution in Europe. But then when it comes to noise, we see that actually the levels remain unchanged between the recent years. So there is no positive trend that we can note, and we are not really on track to meet this target. Regarding the other issues, especially the monitoring assessment, I think it provides quite a comprehensive picture. So I would invite you to look at this website as well to see also targets related to water, chemical source, and so on, which are still quite problematic issues for the European Union. Just to let you know as well that the preparations are now ongoing for the next, so the update of the monitoring and outlook report in 2024. And then there as well, especially in relation to health, the agency is looking into different trustworthy data that can be integrated into this report, including from research. So if there are any results available that could be also integrated into this report, it would be good to have connections there with the Environment and the Environment Agency. Targets, and I will conclude with the last slide, and I'm actually glad that in the previous presentation we heard quite extensive list of what should be the focus for policy and for research in the next years, and I very much would just repeat what have been said, but maybe to add that we really look at the three main. I mean, I would really like to tell you maybe three main messages here. So first, we need to have a narrative that shows that preventive actions are beneficial. I mean, more beneficial than finding a cure. So it's really important to reduce and eliminate health risk. And when I say that, of course, we seek to underpin this narrative with a holistic view of health risk factors, which of course should go beyond the strict health domain. And this is what your projects actually do. And a very important aspect is, of course, the health inequalities. So it's really important to expose those inequalities and then also to address, to mitigate them. It's a crucial part of the Zero Pollution Action Plan to achieve the green but also just transition according to the European Green Deal. And then I only mentioned here on the slide a few knowledge gaps, which are also based on the agency's monitoring assessment. So more information can be found on the website there. But of course, some of the most important aspects is to increase the knowledge when it comes to emerging pollutants and their impacts on health. Then also regarding the health impacts of noise pollution, exposure to chemicals, mixture of chemicals. As we heard, we still need much more knowledge on this. And then also regarding the soil pollution, it would be useful also to know how living near contaminated sites actually affect human health. So this is my last slide. Thank you very much for your attention. And if you have questions, I can also try to answer in the Q&A. Thank you.
Thank you very much, Lorena. I suggest you sit over there because we will start the Q&A session. Peter probably also. Well, I would like to thank all the speakers for their presentations. We've heard how very ambitious the various agencies are. With comprehensive, holistic approaches. I don't know if there are already people from the room here who want to ask questions. And I'm also looking at whoever has questions online at this stage.
Yes, we have two questions of Joanna Bera. The first question is to Dr. Netanyahu. Will there be any report on the triple crisis assessment?
Yeah, thanks for the questions. I was just about to write it. Yes, there will be a report. There will be several products and background documents for the ministerial conference. One of them is looking into into what we have learned from COVID and how we actually connect from COVID to the triple crisis. So in that sense, yes, there will be a paper on that. But I think that much of our work will also have to be shaped accordingly in the next few years, also to address that more in depth.
Thank you. Then another question of Joanna Bera. This is to Ms. Koresek. There is no 2030 target on industrial chemicals in the zero pollution vision. Did the Commission consider such a target, or will it consider one in the future?
The target on chemical target?
Yeah, target on industrial chemicals in the zero pollution vision.
Yes, actually, I'm not. I don't feel competent enough to answer this question. It's also a very, let's say, it's an ongoing discussion regarding the new upcoming proposal for revision of the chemical legislation. So I will definitely take this question with me, and we will discuss with the policy colleagues how in the future targets could be also I mean, I'm sure they will evolve. I'm sure they will develop further, but this requires a very extensive discussion.
Thank you very much. I'm looking at the audience. There's a question. Yes, please identify yourself briefly and.
Hello, I'm Nerea from Hadea. Thank you very much for the presentation. My question is for Lorena. So you have here today a network of projects that are going to produce results. My question for you, could you provide us a clear example of what you expect as a direct output of these projects to the policy? Could you bring us a clear example in which format? How is this interface into the science to come to the policy? Do you have a clear example of how you are going to update the results that are going to produce here today? Do you have any expectation on the format, on the content, on the clear message that you would like to have to update this message to make the policies or provide us an example on how you are doing this today? If you have an example of are the results of Horizon 2020 project or Horizon Europe that has provide a clear insight to the policy making, to the Green Deal, its Zero Pollution Action Plan. So we can encourage them to provide to you these outcomes.
Thank you for the question. I suggest Ms. Lorena answers first, but maybe those who were online may also provide an answer if they can. So concrete proposals, concrete actions, if I understand the question well. Yes.
I have difficulties I had difficulties to hear simply because of the echo, but I understand the question is on what is the expectation of policymakers in the EU for your research results, right?
A concrete example that you will say, yes, this is how I want the results that can help me to develop policy.
No, I mentioned in my presentation the initiatives and tools that we are using, such as the now European Environment and Health Atlas and the Monitoring and Outlook report. And this is where, okay, together with the policy, the knowledge providers, so the GRC, Eurostat, the European Environment Agency, for the DG Environment, for the European Commission, they gather all of this data together to bring these messages forward. So I really would see an opportunity there to connect with the knowledge providers, but especially with the European Environment Agency, to see which of the data could be, for instance, already shown, for instance, in these interactive maps or in the report itself, because every 2 years the Monitoring and Outlook report will be updated. So I absolutely see very concrete links there, but of course it depends on the results as well, and how can they be then integrated. That's why I think from early on it should be properly discussed to see where could be these links. I'm not perhaps I'm not and maybe my colleague Rita could say more following the projects and the results that are maybe already out there, but based on this discussion we should look at it together into these possibilities.
Thank you. Maybe indeed Dr. Araujo could add something there. What are your expectations, and maybe give concrete examples of what you would expect from these EHEN participants?
Well, thank you. A lot was already mentioned by Lorena, but I would like to add that it's very important, as Lorena said, since the beginning to consider this. And I think that the EHEN is at a point where there are already a lot of results available, and it's very good that that you are planning to write and draft a policy brief. And I think the connection with the Zero Pollution Plan Action Plan is very obvious, and there are several links that can be established and identify opportunities how to fit policy. It's also very important to consider the policy needs, and Lorena presented in her talk some examples, but I'm sure they can be developed further and try to understand where the links can be established. The European Environmental Agency is part of the advisory board of EHEN. And every time we have the newsletters or for example, the annual meeting, or there are results that are interesting, we also contact the colleagues and disseminate to the different DGs and also European agencies that are working in this area. So definitely, I think that if results are available and in the areas that are going to be developed in the atlas, that would be a good opportunity also to link to results that then will be used to fit policy. So I would say that the main point is to strengthen a bit this dialogue between the policy DGs, the agencies that make that available for policy making, and the research side, and we can act as an interface to enhance a bit this dialogue.
Thank you very much. I think we'll take two questions from the room. Yes, please. Please identify yourself.
Thank you for your presentations. I was very happy to hear about the aims to reduce effects of air pollution on birth weight. But I really miss focus on the occupational setting regarding reproductive toxicants. I recently conducted a survey and I could see that half of the chemicals registered under REACH had not had any standard requirements for test of reproductive and developmental toxicity. And I will therefore, and also we have no idea how much exposure there are to reproductive and developmental toxicants in the work environment. I know that in Denmark we use more than, I think, 275 compounds in the work environment in pretty high amounts. And these chemicals are classified for reproductive toxicity. So my question is if there are any initiatives that would focus on exposure to industrial chemicals that are reproductive toxicants in the work environment.
Thank you very much. Who would like to take up that question about occupational exposures? Difficult one. Dr. Araujo, I think maybe you could start and maybe say that it's a difficult one.
Well, it's a difficult question because this would be addressed by the colleagues from DG Employment that are working on occupational health and safety aspects and consider the chemicals, but I'm not. I know that chemicals are considered in this legislation, but I'm not sure about the details. So I'm really not able to answer. I will take the question. I can take the question and ask the question to the colleagues and then provide an answer after.
Yes, first Lorena, and then maybe an input from WHO, maybe also. Yes.
I can take the message again. I mean, I do not cover it in my program, but I definitely can bring it with the program that deals with that. Unfortunately, it's mostly being dealt in headquarters, but even though we're supposed to be covering that, we don't have the human resources at the moment to cover occupational health, but I do agree with the question. I mean, this is a very, very important question to ask and address. I can also try to follow up on this here internally if possible.
Thank you, and maybe Lorena.
Yes, I don't have an answer to this important and difficult question, but it is a big, let's say, discussion. Our colleagues in the chemicals unit are quite under pressure to meet all of these expectations. Of course, the aim is there to reduce the exposure to really hazardous chemicals as much as possible. But I would maybe we can discuss afterwards, because I really have a bit of difficulties to hear because of the echo. So we can I can really bring forward this question also internally with the policy colleagues. Thank you.
If I may say that there should have been a talk on this very topic on occupational exposures, if I'm well informed. Maybe Peter can confirm that there has been some difficulty in finding somebody who would talk about this very important issue. Okay, thank you. And I think we'll take the last question because we've reached the coffee time. Please, a brief question and hopefully brief answers.
So I'm Heikki Hyöty, Finland. I have a comment and suggestion and a question, all are short. So my comment is that I really like this holistic approach, because of course it's obvious that if you have multiple exposures to different kind of pollutants or threats, can be detrimental to the health. But I also think there's the other side of the coin, that you also have additive health promoting effects in the safe environments. If you think about like forests, which is not polluted, it can have positive mental effects and positive physical effects because you exercise there, and a lot of other positive effects. So my suggestion is that could we consider creating this kind of showcases, like living laboratories in big cities, so that the citizens could really experience how good it feels to live in the health promoting environment, and that increase the motivation of all of us to invest both financial and human resources to build our environment to that direction. And then my question is that I know that the microbial safety is also very important in the policies, especially in drinking water. And there's at least according to my knowledge, quite strict regulation how microbes are screened in the drinking water in EU. So is this included in the like pollutant category, or where it goes in these policies you described?
Okay, thank you. So the role of microbes, did I understand it correctly? Anybody wants to intervene there? So infectious and maybe non-infectious contribution of microbial organisms.
Yes, actually, this is the question for the drinking water. This this I would you will give me a bit of time to properly check the legislation. But then in the proposal of the for the revision of the wastewater treatment, there is a proposal to monitor also viruses and as well as pharmaceuticals. So there is a proposal which is now being discussed to have a better be discussed with the parliament and the council and it will depend on the final negotiation and conclusion. But the aim is to also track this other possible microbiomes and so on in water. But let's see what comes out of this negotiation.
Thank you very much. Brief comments possibly from WHO or the other DG? Apparently not.
Oh, no, I don't have comments on this. It's well, it's possible legislation in this area is not under our responsibility, so I cannot comment on this.
Okay, thank you. I think many of you are dying for a coffee. We will close this part of the morning. Coffee will be not in this building, but in the building ONN2. You will be guided by the local people here. I've also been asked to mention to load Mentimeter over coffee. This is needed for the questions, I suppose. Hopefully you understand what it is, because I don't. And we are supposed to be back here at 10:50, but let's give us 5 more minutes and be back at 10:55. Okay, thank you very much. Okay, I understand that 11 is the time to be back here. At 11. See you there.
Bye.
Oh. Once it works, you can easily. Okay. I'll give the floor immediately to you. Hello, welcome back, everybody. We'll proceed now with a presentation called Exploring Key Policy Challenges and Drivers, workshop actually. And that will be presented by Hubert Derven. He's from the Norwegian Institute of Public Health in Oslo, and he's one of the partners in EXIMIOUS. Let me give you the microphone.
Thank you. So we have now heard in the last days that we are generating a lot of knowledge. We just heard a very nice presentations from the European Commission and from the World Health Organization about policy needs. And now we try to understand how we can bridge the knowledge we have and the policy needs. So I hope that everyone has downloaded the Mentimeter app. The code was, can we go back to the code? Yes. Or you can go to menti.com and enter the code 670739, because we have some questions and we really like to know you a little bit better and to get more knowledge about your needs and obstacles that might exist. So we have 42 participants now, 45, almost 50. 50, very good. So if you open it, then you will get some questions, but we will also show, we have a person online, Ule, who will also show the questions on the screen, but you have to answer on your mobile or on your PC. Yes, so there will be a number of questions, and we will try to analyze the results. So the first question is, please select the option that best describes your primary role, so that we know who you are. Are you researchers? Are you policymakers? Do you work in industry? Do you work in NGOs? That is the question. I see that we have a lot of researchers in the audience. Yes, we immediately go to the next. We don't have time to look at the results, I understand. We just go directly to, is it Ule who's doing this? Yeah, maybe it's good to show this a little bit. So yeah, the majority are researchers working probably in the exposome projects and doing the work there. So we have one policymaker, and we have some people from industry, some people from NGOs, and some others. But the majority of the audience participating is a researcher. So then I suggest that we go to the next question. On which level do you primarily work on policy-making issues? Are you mainly working on an international, on a global level, or in the European Union, on national level, in a regional level, on a local level, or other? We see that we have some persons working on an international level, but the majority is working on an EU level or a national level. But we have quite a good mix of responses here. That's very good. Okay, 72 people participating. That's very good. So then let's go to the next question. Which of the following components of the exposome do you consider most relevant to your work? And please select all that apply. So it's air pollution, water pollution, noise, built environment, food and diet, climate, chemicals, occupational hazards, socio-economic factors, others, or none of the above. Like I said, you can have multiple choices here. Don't. It's not a problem. Get more insight. But based on the results that we see on the screen, we see that we have quite a lot of people working on air pollution and chemicals. The built environment and the food and the diet and socioeconomic factors are then in second place, although socioeconomic factors are increasing now a little bit, is now number 3. And we have some people working on water, climate, occupational hazards, and others. And none of the above. That is very specific. I would like to know what that is then, that you're not that what we are missing in this list. But okay, we can maybe come back to that. Okay, thank you. Can we then go to the next slide, please? How would you rate the level of collaboration between policymakers and research in your field? Do we have a strong collaboration, a moderate collaboration, a limited cooperation, or no collaboration at all? No, here it's only one choice. Yeah, we see that we have moderate and limited are the winners. There are some people who have no collaboration at all with policymakers, and some have a very strong collaboration. But moderate and limited is the main choices. So there's room for improvement. And then we will go to the next question and try to answer this. So what is then the factors hindering collaboration between policymakers and research in your opinion? And there are 7 options, and you should rank them to what is the most significant hinder and what is the least important one. So it's communication barriers, unclear terminology or jargon, differences in priorities and timelines. Sometimes we consider that one study is not considered to make decisions. We miss a holistic viewpoint, lack of funding, differences in priorities and timelines, and limited opportunities for regulatory interactions and knowledge exchange are the options. So if we see here, we have only 28 people responding, so I think we need to wait a little bit. 56 people have now submitted all these 7 options. Yeah, so it's quite diverse, the barriers that we see. But number 1 currently is the limited opportunities for regulatory interactions and knowledge exchange. Second one is differences in priorities and timelines. The third one is the communication barriers and unclear terminology jargon. We don't understand each other. The fourth is this fragmented presentation of results, miss and holistic view, lack of funding for joint research and policy projects, studies not considered sufficient. One study is not considered to be sufficient to change policies, and unclear what the societal impact of specific research findings are. So there are quite a number of barriers that are identified. And then we are very interested in how can we improve on this. So that is going to the next question. So what is the best way? The best way that policymakers and researchers should meet in order to communicate and exchange knowledge. And again, there are 5 options, and we like to score what is the most significant one and what is up to the least significant one. And the choices are attending joint conferences or workshops, participating in research policy exchanges or secondments, engaging policymakers in research design and development of research questions, co-authoring research publication and policy briefs, and creating dedicated platforms or platform of forums for regular dialogue. Yeah, so we are almost approaching 70 responders. So the number 1 is the engaging policy makers in research design and development of research questions. So they should be involved in a very early stage, and not when we have done all the research. Participating in research policy exchanges or secondments. That would be very good if we can have more direct interaction with each other. Creating dedicated platforms or forums for regulatory dialogue, attending joint conferences or workshops. And the one that is on the 5th place is this research publication and policy briefs that we write them together. Then we have another question to get some more insight in this. What are the key challenges in translating research findings into actionable policies and programs? And again, we have 6 options, and we like to know what is the most important one according to you, and then rank them again. Yeah, we are approaching 70 responders. So what is the most what is the key challenges is inadequate communication between the researchers and policymakers. And then the second and the third option, the complexity of research findings or political considerations that are considered as a barrier. Resistance to change, lack of stakeholder engagement, and time constraints. That's it's time is always a problem, but it's good to see that it is not scored as the most important challenge. I think that's very good. Then we had some questions specifically for policymakers, but I still think it would be interesting just to run them through the whole because we have only one policymaker in the audience responding to the survey. But I really think it would be interesting to it's only 3 questions left. Let's try to do it. So, do you currently engage with researchers? Yeah, if you're a researcher yourself, then it's not applicable, of course. Yeah, so it's good to see at least that people that are not actively working in the research field do engage with researchers, the majority at least, and that there are some a minority is not engaging directly with researchers. Okay, the next question then. What are your key policy challenges? You can select all that are relevant. Lack of funding or resources, difficulty in implementing policies, limited stakeholder buy-in or support, waiting for European regulations, inadequate data or research to inform policy decisions, and challenges related to cross-cutting policies. Yeah, here we have quite a good mix of different different policy challenges, funding. They should be combined, of course. Difficulty in implementing policies, a limited stakeholder buy-in and support, inadequate data or research to inform policy decisions, challenges related to cross-cutting policies, and then also waiting for European policies or regulations. And then the last question, we go to that one. Which of the following research outputs do you find most relevant when developing policies? Is it the research papers and publications, webinars and training materials, policy briefs and recommendations, tools including guidelines and protocols, or none of the above? Yeah, well then, research papers and publications is quite high in the ranking. Again, policy briefs and recommendations is quite good. and tools including guidelines and protocols, the toolboxes, for example. And then webinars and training materials is on the fourth position, and research outputs, none of the above. This was the last question, if I'm correct. So thank you very much. I think we have maybe 5 minutes just to have a short discussion about this. We see that we have, we are producing a lot of research. We write papers, we write policy letters, we develop tools. So we produce a lot of output, but we are interested in that others will use the output. So we are interested in the outcome, and we are of course very interested in what is the impact of all this work. So making the difference. Is there someone from the research area who wants to comment on some of the results from this short questionnaire, from this short survey? Is there someone who thinks this is something we should take into account and maybe improve upon? No one? Is there someone from the policymakers then who wants to comment on the findings of this survey? I don't know if there are people online who like to say something. Not yet. Okay, it's also an option, of course. Yeah, now, well, maybe I can say something then. It is really, it is really important that we have a good we have a dissemination strategy in our research proposals, but that's a one-way process. It should be in communication so that we talk to each other, and preferably it should really be knowledge sharing. Is there a question there, Peter? You want to say something? That's good.
Yeah. More or less the same as you were starting to say. I think, I think it's the exercise is really there that as researchers, and I think I consider myself a researcher. It's difficult to talk the language of the policy makers, and we are really focused on publishing as most high-ranked papers, but I think that is where the communication goes wrong, because we try to do also other type of publications, but I think the high-ranked publications are very good to collect good research, but that is maybe not the best way to talk to policymakers, because it is not translated to what more, what you really expect that will be the impact of certain issues and so on and so on. So there should be something in between, and we should also get a reward for that, because as an academic researcher, you get mainly rewarded for your higher ranked publications, but just more general publications, it's more difficult to produce, and you do not get really a credit for that. And so I think there the system is lacking something.
Yeah, there's another question. Please state your name and your affiliation.
Thank you. I'm Horatiu Moldovan from Romania. I'm an occupational physician and work in EXIMIOUS project. Regarding this aspect, I think we should, as researchers, to translate our work in a common language, in a language for policymakers. And I think we should focus on how they used to work in their daily activities. So they rely on the information in press, in media, not only social media, but I think if he will translate our research results in such languages, using press conference at national levels, at local level, where we used to work. I think this could improve this communication with policymakers, and our results will be translated in legislation or in decisions. Thank you very much.
There's one question online. Ola El Saleh asks a question to the researchers. Do you intend to engage policymakers in research design development? Because I think that was scored very high. So are there researchers who answered that question as really high and would comment on that? Or online, that's also possible. We can unmute you. Ah, yeah, thanks.
Hello, I'm Benedict Jacquemin. I'm from INSERM and I am environmental epidemiologist. And actually, I was very surprised that it ranked quite high. As for me, there is a big conflict of interest in some way. And also, I wouldn't be happy as a researcher that policymakers make comments on the design, because we have our own work and we have studied many years to know which design is better. So maybe the problem is the question was together research design and research questions. So I agree for the part of research question, but not for research design.
Yeah, then we have someone. It's good exercise. Yeah?
Yeah, I found this response particularly interesting, and I understand what you're saying. I don't think there's a conflict of interest in co-creation, and but I understand the challenges sometimes that you have to share expertise. But I think this response was particularly interesting because we see a quite disconnect between researcher who wants to do things and not necessarily want to write report and brief, and because that was really ranked last, like the thing that I think that maybe also highlight the fact that we don't know how to write them, or we don't know how they are read and understood, or what is next. So I think that I would like to maybe have also comment on that from policy makers.
Yeah. Yes. How to bring these two words together? I would definitely agree. We need key messages that can be very easily digested by policymakers, because it's true, at the end of the day, we don't have a lot of time to read all of the scientific papers. So I think these policy briefs are a good tool. So showing the key message, how the environmental pressures affect human health, what kind of diseases can be developed, how much does it cost for the health sector, for the society, if we have this disease burden. So these kind of assessments, impact assessments, are very useful. But then with showing really in an integrated way, so how does it affect human health, our society, also the socioeconomically, how does it affect vulnerable groups of people, and also then at the same time showing what are the limitations of this study. So, and as somebody mentioned before, working with the tools that we already use a lot. And I mentioned before, we really work closely together with the EU knowledge providers, so the GRC, Eurostat, and the EHEN, and we are used to work in this way. Also taking on board the research results, but they have to somehow fit into this in this framework of so these tools that we do use. So I'm not sure if I can be very helpful, but yeah, it's very important to have these key messages on the impact in the way that you can produce these results, because this does affect our policy narrative. And if we have a figure of how much does it affect a certain exposure or the health of citizens in Europe, we can easily use it in our speeches, in our policy development. So absolutely,
Yeah.
this would be very important. But of course, with mentioning the methodology and the limitations of the study, to really very in a quick way try to understand how this was done and how it can be also improved for the future.
Okay, I think we need to close. But yeah, it is important that we understand the policy needs, and also that the research of the policymakers understand our research. I've been in a number of European meetings now, and impact of our research, you know, the European Union is investing quite a lot of money in research, and they want to have some impact in return. And I guess that is maybe in future programs even more important, that we think a little bit about, well, how can we use this data in policy making. So thank you for your participation. I hope it was useful, and I give the word back to the chairman.
Thank you very much, Hubert. It was a good fun, this workshop. I hear there was another question from online, but those questions that have not been addressed will be addressed by email later on, so that we don't ignore those who have not been able to speak. So now we will start the final part of the session and the day. And I'm pleased to introduce Sylvain Seberts from the University of Oulu. He's one of the co-organizers of this meeting, and he's a PI of the LongITools. Is that correct? LongITools. Okay.
Okay, thank you so much for the organizer and everyone here has been able to make this event possible, and it's quite my pleasure to try to finish or to stimulate for the next Q&A and related to how do we support policy challenges, and especially how EHEN, well, we are only part of the tip of the iceberg here. How can we help in these challenges? So I'm indeed Professor Sylvain Seberts. I'm from the LongITools project. I'm very privileged person, and I work in the University of Oulu. We have the cleanest, the safest, and the happiest country in the world. And sometimes it's quite difficult for me to see why don't we have that for everyone. But what is also challenging sometimes for us in living in the outskirts of Europe is to find out how we can actually connect the dots between what we are doing and what is needed. And events like that are really, really important for us and for all the, I hope, for all the researchers. And I want to try to bring the discussions, and especially a little bit continuing discussing a little bit on the exposome and why we think that it's probably very important and not so surprising that EHEN is the biggest cluster in environment and health. It's it's necessary to understand that health is a condition that in which people achieve control over their lives because of the equitable distribution and power of resources. And it's really important, and that's what we are observing now, is that health is really something that is collective. This is something that we are sharing together, and really we cannot achieve health in the expense of the use of natural resources. And I think that's something that I really learned working in the LongITools, but with the exposome to really enlarge your view of what is health and how does it really work. And so we had quite challenges in terms of policy. I realize that you also have amazing challenges to tackle health at the global level and to promote zero pollution action plan. It's not something that we can achieve every day, and so how can we help? So what is really important and what I want to share with maybe with you, and but also with policymakers, or is it's we now with the exposome EHEN, we really understand that environment cannot be reduced to one single element, and that's one thing that is really important, is that we really need to continue, as we see with so many great pictures, that we have to stop working in silo. We have to be able to work together, and also what we do, and that's why we need so much data, and not only omics but also population data, because we need to understand how do we achieve this in a really complex system approach. So we really need to develop systemic based policies, systems-based policy. And I think in what we saw during the last 3 days is that EHEN in actually in just 3 years we grow so much, and I really believe that what we are achieving here is we can really be a good partners for health and environment policies. And just giving few examples that is available in here and to be able to achieve that before we can provide our policy briefs. And but the thing is, in here and what we have developed in these things that we haven't been highlighting so much during these meetings, because we wanted to especially focus on the science, but we have fantastic live course cohorts and health data catalogs that has been developed, that is really available, and not only available for research, but it's also available for policymakers. And we I think for many of us, we would like to realize that and help realizing that. You were mentioning that you use Eurostat and this type of data, but we realize that you have a lot of missing data in that, and especially data from longitudinal process and on how the demography is working, and that's what our catalogs also can bring to policymakers. So of course we need much more time to make them operational for policymaking, but this is what we are trying to do. So you were saying that we need to engage, and then we together we also achieve a network of scientific experts and I think we have more and more opportunity for really rapid science-based solutions and recommendations. So we have the feeling sometimes that it's a slow process, but now that we have the EHEN, I think we have the possibility to really have a much more interaction and much more opportunity to go fast. And together, and that's what we have been trying to do with, not sometimes with the help of the GDPR, that we have a great network of stakeholders. So we only have a bit of stakeholders here, but we have a huge network of stakeholders that can really connect us. And then what is really important, and that's something that we haven't mentioned so much, even it's policy, but it's also part of it. We have a very large potential with multiple SMEs for innovation. and innovation in health, but also innovation in policies. So that's something that I think EHEN can greatly contribute. What I want to say also is that if we think about the value chains of research in EHEN, EHEN is I think more and more, or at least that's what I'm seeing from my outskirts of Europe. I think we have a really designed EHEN for science-based policies. What I'm trying to say here is that actually we are not just epidemiologists who are looking at the associations, but we really try to triangulate, or I don't know how you'd say that in English, but we have octagons where we can really have so many opportunity to have evidence, to test the evidence with experimental research. We have health economics, we have ethics policies, and we also have those city labs and participatory research, and again, it's semi-innovation. So we have a really good value chains in this process to strongly influence and to help in the policy and science. And so sometimes we don't know whether it's policy making or it's just making interventions or making preventions. But I think the message is that we really are here to help. But I really wanted to finish this presentation by a sort of message, because I think it's so important. So of course I'm come from the biological backgrounds where we really thought first that it's so important to understand the mechanisms of biology, etc., to go deep. But we realize that it's also very important to understand the population dynamics and the importance of the environment in health. So just want to leave you with these two very important quotes. I think that this applies a lot to social science, but it also applies to environment and health in general, that it's the same cause that wears out our bodies and clothes. And just want to finish that we really need to work together, because why treat people only to send them to the environment that made them think in the first place. So without further ado, I leave the floor to you for the final Q&A. Thank you very much.
Thank you very much, Sylvain, for these words and the final quote. So the floor is open for questions, comments. There's already one hand up there. We will start with you. I don't know where the microphones are. I gather there will be questions from online, perhaps also. But let's start with.
Hello again. I really trust that the policy can make a change, and you really strong, but it will also reflect the question to all of you that are working, that have a lot of dissemination and communication plans. So there is a part that can be also done to the citizen in a direct way, to change the behavioral chain of these people to do other things. My question for you is, what are the other options that you are working? Not just so focused communication and dissemination, but maybe it's so naive, but we need just nice TikTok to approach to the generation, to no smoke, or to other approaches that are not focused only to policy changes, but more behavioral changes. How do you have this approach? And if you, as a researcher, has a good communication skill to go there?
Well, I can
maybe summarize the question briefly, because it was difficult to understand. So briefly summarize so that we realize that you understood what she asked.
Okay, yes. No, I think so. The question, I think, is how do we disseminate, and how do we reach the public, and how do we interact with public, which is not necessarily, should not be excluded for policy making as well. So I think this is something that we are well, in all the projects, we have those great dissemination and communication teams, so which are actually the organizer of these events. And so we have quite a lot of little things at the local levels, but that grow together, where we try to interact with city planners. We try to interact with, and we try to make participatory research as well, to try to get the population involved. I speak for myself. We are doing cohort research and life course data collection. So we have a great opportunity to always go back to them and get them involved in the research and to understand what it means. But that's one example. I think people have more example. And
yes, please, at the back first.
This is rather a comment for discussion. I notice that from the stakeholders, there is a wish to know more concretely what the exposures really result in terms of health and the burden to society, etc. And this is something that I think all of us in the scientific community would like to be able to provide. But at present, combining data on the exposures with health data, well, it's not exactly forbidden, but it's quite complicated. So a lot of the research does not really have health data related to it. And I think that if we are going to be able to provide more data that's relevant for the policymakers on how the exposures really affect health, we need to do something to make an easier access to health data possible. Thank you.
So that was a comment. Maybe you want to react, Sylvain, on that comment rather than a question, I suppose.
No, I can just agree with that. That it's not an easy task. Yes, it's to provide the proof, and sometimes we lack the right information, we lack the data, but so it's, I think what you're trying to say, that yes, we would like to be concrete, but as researchers, sometimes we are struggling with our own difficulty to understand what we are observing, and how far can we be confident that on.
Okay, who was the next questioner? Yes, please.
Hi, good morning. Sorry, this is very loud. So thanks for this presentation, Sylvain, and the other speakers. My name is Juliana Angelova. I represent the Health and Environment Alliance. We're a partner in the Athlete Project. We're also involved in another network, CUSP, that was mentioned earlier in Rita's talk. And just to add to what our researcher colleagues, because we really do work with them hand in hand on a daily basis, what they were saying is, I think to follow up on Nerea's question and her comment, I think it goes hand in hand. So there's the policy approach in terms of what level you want to reach when you're doing policy making and coming up with regulations. And then there's the citizen science approach. And in many of our projects, we do this through intervention studies and co-creation and participatory research processes, like Sylvain said. And through some of these activities, citizens themselves take part in the studies that we conduct, and they also engage locally. And so we're showing them how to be part of these discussions at a local municipality, national level, that then directly feeds into policies that are often decided at an EU level. So I think it's a hand-in-hand approach. We do this on a daily basis. Perhaps we're not reflecting it as much as we should, so that at the policy level, they're getting that information. To what extent citizens do get involved when it's possible. Obviously, some size studies at a very cellular and lab level don't involve direct citizen participation. So I hope that adds a little bit to the discussion.
Thank you. I think there was an arm up there. Okay, we'll take the question online after that question. Yes, please.
Oh, yes, Heikki Hyöty, Finland. So this is just a comment. Actually, I had the same point as the previous one. So I think this citizen science concept is very powerful way to have stakeholder interactions, especially with citizens, but also policymakers. When we carry out clinical studies and where we recruit and follow families or study participants. So that's a unique opportunity to interact with the society. And maybe we could develop that concept further, utilize the social media better, and also engage them more to the decision-making processes.
Thank you very much. From the online participants.
Yes, there was a comment of Jos Bessems, and he says, I really like the participation approach that was mentioned in the last meeting. This is, I think, key to close the science policy citizen voters triangle. This could be included in many more HEU-funded projects. Participatory approach is broader and deeper than just communication. And then he follows up also with another question. Should we help researchers to deal with the sensitivity issues linked to health data and GDPR ethics? In safe harbor, citizens would be maybe more willing to share their health data.
So would you like to give an answer to the question? Maybe repeat the question briefly?
I didn't really hear well, sorry.
So
You got it, okay.
the question is, should we help researchers to deal with the sensitivity issues linked to health data like GDPR and ethics? In safe harbors, citizens would be maybe more willing to share their health data.
I ask who asked this question?
Jos Bessems has this. Jos, if you're willing, you can also unmute yourself and show yourself. Then we have a better discussion.
Thank you very much. The idea is that I hear an echo now. Maybe we should
we can hear and see you. That's go on.
So
No, we have a technical.
Yeah, we have to turn out our own microphones for a moment.
Hybrid sessions are difficult.
But if I understand the question, I think it's more about research ethics and especially how to proceed with this science and citizen research, where we really need the support. And what is really important is ethicists should be also involved and to really understand how we can address these questions. Because of course, well, when we do, let's say, general population prevention, that's relatively easy in a way that you don't really have to deal with some stigmas. But then you really need to go to vulnerable populations where we know that there's a sort of a very important social and environment inequality, and this is very important in relation to health. How do we do that? How do we achieve? How do we engage this population that also sometimes are lacking trust, not only in science but also in policies? So that's something that I think we also really need to understand human being in all its complexities. So that if I answer your question or give support to your questions.
Thank you. I saw you nodding. Any additional question or comments from Vito? No, we don't hear you. You're muted.
But please send us your question online or via email, and we will try to.
Yes,
address
that's a good option. Thank you very much. Unless there are, yes, there's a question from Emily.
Sorry, I'll abuse my microphone runner position. My name is Emily Chiscato. I'm part of the EXIMIOUS project and part of the communication and dissemination working group of the network. And I just have a question since we're here and we have an opportunity to discuss about this connection between research and policymakers. I think we're quite fortunate to be within a network with policy officers and project officers that help us make this connection. They helped us have our invited speakers here today. But what are we going to do when we leave this room? How do we maintain this connection with the policymakers? How do we expand it further? And so I guess my question is now directed to Lorena or also to Laia, Nerea, if you have other suggestions. What should we be doing that maybe we're not doing?
From my side, I would say keep bothering us and asking this in a regular basis. So what is next? How can we participate? I don't know if Lorena will be able to invite you to some inter-service consultation, any task force or anything. So it's the only way is that we help you to bring the hands from the science to the policymakers. That's the idea. So from my side, I'm really open that you keep asking me this question, what can we do? We have this, but also that you raise your hand. When you have something to say, raise your hand, give us clear message. We have this is coming out. Provide us with summaries in your deliverables that we can easily read at the experts, so we can pass this message. So I'm happy if you keep bothering us and asking this question again and again.
Yeah, I would say the same of Nerea. I think that the meetings that we have with the EHEN, with the coordinators, it's a very good moment to bring this, and also maybe the coordinators to engage more the partners on what are the activities that EHEN is doing and how the partners can be more engaged. And yes, what Nerea was saying, it's very important because we not only monitor EHEN as a cluster, but we are very eager to also disseminate and communicate to policymakers the individual results of the projects. So I think that good communication with the project advisory and HADEA is also a way to raise awareness of what are the results or what are the initiatives, what are the products of communications. I discover videos that are made in the projects that they are very valuable to raise awareness, to also inform citizens because they are very easy, they are short, and they explain very well what is the aim and what it could be the social impact of these projects. So please, for the coordinators, for the partners to communicate with the coordinators, all this information for us is very useful, and also to bring them to the policymakers.
And just last thing before I pass the microphone, I will say be ready to respond in a short time because the policymaker needs fast responses. So you have to be ready to provide maybe in 1 week or in 15 days a clear answer to a policy question. That's my thing. Be always ready.
Thank you. I didn't want to put this pressure on on the projects here, but so how we can keep this contact? It's a question now, and I would say I am quite positive because I am here today, and it's actually not a lot of projects that we do see and do interact with so far. We have to improve on that for sure. I was explaining to colleagues here. So in DG Environment, we have a quite young team now that try to bridge this policy and research words. And our main contact point is, of course, DG RTD. I think Rita is not anymore in the meeting because she is presenting in the info days on cluster 1. But I am very positive because we have very good collaboration with DG RTD and we keep each other informed. So I would, and I already discussed with Rita specifically, we are ready, so me and my team, to receive information and to, when there are deliverables, to have opportunity also to look at them, because we are not a coordinator and we don't get this information directly. But Rita is very much informing us very timely, and from now on, if we have this opportunity, we have this connection, we can see for the opportunities in terms of what more presentation we can make, also to really the policymakers, because I don't work in the on the policy implementation. I'm there to help the policy colleagues, but they are very keen and they really want to engage more. It's just the matter of capacity, of time, and so on. So it's also my responsibility now to find the right moment to present more of these upcoming results that come from your project, to constantly engage with DG RTD. Yes, I think that's surely what I can promise to do. Yeah, with DG RTD, we keep on in touch. But also what I said, it would be very good to enhance this collaboration also with the Environment Agency, simply because it's such an important knowledge provider for the DG Environment, and there also I and my team can help to bring together colleagues also from the agency.
Thank you very much. There's a question or a comment online, which will be the last one. Then you will have the final word.
There's a question of Jos Bessems. I will read it out loud. Could the funding agencies, DG, RTD, etc., maybe stimulate researchers upfront to enable citizen science and participatory approaches by putting these issues in the required topics to work on in their calls for proposals? I guess that is a question for the funding.
Did you get the question? It was addressed to Lorena, wasn't it? To Lorena, yeah.
I'm not sure. And can you just maybe, because I thought I could find it here, but I cannot. The citizen science and how the Commission and the agency can support it is.
Yes.
Support and encourage. Was it?
Yes, I can just confirm it's a very important aspect also in terms of how to raise awareness among citizens, as we heard examples before. So I think also now in the current work program of the Horizon Europe, there are calls to increase the citizen science and participatory approaches. We have the Horizon Europe missions where it's really a crucial element to engage as as wider groups of stakeholders as possible. So it's our aim to support and further encourage this dimension. There is no question about it. I don't know exactly how specifically concretely I can answer this question, but just to say that it's all that I mentioned. We have all these what is it? These conferences with citizens and so on, and it's always a very important factor that we in our research team have to consider. So when we do the work with DG RTD and DG Agri and other DGs to develop new calls, we all think of this aspect as well. So I can just confirm we will keep doing this, and it will come up much more prominently, I think, also in the next work programs.
Thank you. Sylvain, do you have anything to add to the various comments and questions?
I had a final questions and final words maybe, but can I have final question? I would like to be in a very concrete level, and I'd like to really to know because what I think so. I'm speaking on behalf of researcher, maybe not, and but what we are afraid sometimes is that what we are providing is drop in the ocean. And so we would really like to have something very useful. So, and we would like to know how we can work together. So it's just sometimes we provide a policy briefing and it goes there. So we would like to know how we can work. So do you like it a bit like the WHO? Do you commission, not with fundings, but do you commission researchers or a group to prepare a policy briefing? Or do you wait for us to provide some options? What I'm trying to say is, how can we be more efficient?
Maybe you'll not be able to answer immediately, but I think the question is there for the future.
For the future, yeah. How can we cooperate and collaborate?
It's good that we ask this question now, and it's definitely something we have to think about it. As I said, I am a little bit dependent now on the project coordinators. So this is our main contact point, and it has to be, of course, in the first place discussed with DG RTD. How this could look like, because sometimes I receive those policy briefs, but it's a little bit too far from what I do and from what is really interesting, and I'm going through them and trying to find the main message that I would like to convey then to policymakers. So there is an idea there that we could maybe have a bit more contact, more direct contact at this point, just to something very short, just to understand what are the main messages and how we could then translate them also to be understood better. It's something to think about, but apologies for not having enough of experience in this area, since we are still learning by doing now, and hopefully we can really try to engage more with projects themselves to really. This would really help us, not just for the policy making, but also for the research policy making. which is of course very important. And for now, we are just supporting the research policy making more indirectly and more indirectly supporting the policy making. But let's discuss also with Rita and find better ways.
The micro just there, and then there's also a question at the back there, and I think that would be the last one. No, go on.
No, I just wanted to say that I think the policy briefs are very important also to raise awareness about the research that you are doing and how you researchers also are dealing with some societal challenges. So it is also a way to give the voice of the researchers to the policymakers, how you see that your research can contribute. So I think that it is an important. Also, I would say that the cluster, it is a good tool for that. You raise awareness of how not only about your topic, because maybe not everyone knows about exposome, but the particularities of other topics that within the exposome that would be not that visible at the policy level if it was only in silos or only at scientific level. So I think that that is really important. I also agree that maybe agencies could be more engaged, and we will try to engage more the agencies that they have the technical knowledge and the scientific knowledge to make most of the results that the cluster is providing.
Thank you. The last comment or question?
Yes, Heather Coombs from the HEAT project. I'm a member of the Communication and Dissemination Working Group. On our work plan for this year, we have to produce a policy brief. That's as much direction at the moment that we have. So what we would be looking for is a title for the policy brief, the first one we produce, and ideally a format so that it has the best chance of being translated into policy. So at the moment, we really need direction from the board and from the policymakers, and so if we can get going on it, it would be great. So that's just some feedback from ourselves.
Okay, thank you for that question and proposal. We will close the session now. Thank you very much, Sylvain, and it's my brief to say a few final words, but we'll give a clap to Sylvain. So in closing the session now, I would like to commend the organizers and EHEN for a very ambitious project. You want to be both holistic and focused, which is a little bit of an antinomy, but I've been impressed by what you are doing. And I liked this exercise, this initiative in communication between researchers on the one hand and policymakers on the other hand, and not forgetting, it's been said, various stakeholders, including the public and citizens. I see that Peter is coming to the mic, or not specially. So then I would like again to congratulate and thank the organizers, the local organizers, Peter, those who were backstage or front stage here, Emily, Lauren, Manosic, Stephen and Rani, and all the others. Thank you very much. It's been very well organized as far as I can gather. I would like to also to thank the attendants, both those who are here in the room and those who participated from afar. You can go to the EHEN website and the newsletter to have more information. I suppose a lot of will appear in the coming days in terms of recordings and maybe various summaries. I've also been asked to that you complete the feedback forms. Yes, it's projected there. And then it remains for me to invite you for the lunch, which is the same place as the coffee, yes. And with this, thank you all again, and I'm closing the event.